The first thing Marta Vogel expected to see was a blade. Instead, the American doctor came through the door holding a folded wool blanket. Not a syringe, not a strap, not the silver instruments Marta had been trained to fear. A blanket. That was what made her hands start shaking harder. She was lying on a metal examination table in a captured schoolhouse outside Liège. December 1944. Her uniform still smelled of smoke from the Hurtgen forest. Dried blood had stiffened the cuffs of her sleeves. Two American orderlies stood by the cabinets. A translator waited beside the door. And Marta had already decided what was about to happen to her. She had been told for 2 years that American medical rooms were not medical rooms at all. They were interrogation rooms with white walls. But in the next 12 minutes, Captain Ruth Halden did something more dangerous than cruelty. She treated Marta like a patient. And that was the beginning of the end of every lie Marta had survived on. 3 nights earlier, Marta had been working inside a German dressing station carved into the cellar of a ruined farmhouse near the Hurtgen forest. The building above them was almost gone. Only one wall still stood. Snow came through the ceiling boards and melted on the blankets covering the wounded men. The cellar smelled of iodine, wet wool, urine, and old smoke. The surgeons worked under 2 battery lamps that flickered whenever someone opened the cellar door. Marta was 27 years old. She had trained as a nurse in Dresden before the war narrowed every life into an assignment. By late 1944, she had learned how to cut uniforms away from frozen skin, how to hold a man down while a doctor took a leg he would not survive anyway, how to make half a vial of morphine feel like mercy when there should have been 10. She had also learned not to look too long at faces. Faces made the work impossible. That night, the American shelling began just after midnight. First came the distant thump, then the closer crack. Then the cellar shook so hard a tray of forceps jumped from the table and scattered across the floor. "Keep pressure on the artery," the surgeon shouted. Marta pressed both hands into a soldier's thigh while dust fell into her hair. The boy on the table was 19, maybe younger. He kept calling for his sister, not his mother. His sister. The next shell killed the battery lamps. For 10 seconds there was only blackness and screaming. Then the cellar door burst inward, and white winter light cut down the stairs. "Hands up!" The German words were broken, but the rifles were not. Marta raised her hands. They were slick to the wrists with blood. An American soldier aimed at her chest. He looked as frightened as she felt. Behind him, a medic pushed past the rifle and dropped beside the boy on the table. "He's bleeding out," the medic said. "He is German," Marta whispered in English. The medic did not even look at her. "I can see that." Then he tore open a dressing packet and went to work. That was the first crack. Not enough to change her. Not yet, but enough to confuse her, because enemies were supposed to let enemies die. At least, that was what Marta's own side had done, often enough to make it seem like the natural law of war. The Americans separated the medical staff from the combat troops before dawn. Nurses, orderlies, and 2 junior doctors were placed in the back of a truck under guard. The truck moved west through broken roads, past burned vehicles, and men sleeping upright against ammunition crates. No one beat them. No one searched them roughly. No one called them animals. At noon, an American guard handed Marta a tin cup of coffee, so bitter it made her eyes water. She stared at it for a long moment. "Drink," he said, not unkindly. "Cold day." One of the German nurses beside her muttered, They are fattening us before questions. Marta wanted to believe that. A trick was easier to understand than mercy, because Marta had been prepared for American captivity long before it happened. In the summer of 1943, she had sat in a military auditorium in Leipzig with more than 200 nurses and medical assistants. The windows were blacked out even in daylight. A medical security officer stood at the front beside a slide projector. He was not a doctor. Marta noticed that only later. At the time, she noticed the photographs. A woman strapped to a table, a prisoner with bandaged eyes, a surgical tray beside a body under a sheet. The officer told them the images came from Allied facilities. He said, the Americans pretended to respect the Geneva Convention, then used German prisoners for experimental procedures. He said female medical personnel were of special interest because they knew supply routes, surgical weaknesses, and the true condition of the army. Do not be deceived by courtesy, he said. A gentle voice is the first instrument. Everyone wrote that down. A gentle voice is the first instrument. He told them routine examinations were a cover. Blood pressure meant weakness records. Dental checks meant identification. Questions about pain meant interrogation. Requests to remove a boot or sleeve meant the beginning of control. One nurse asked what they should do if the Americans forced them to cooperate. The officer smiled. Endure. Observe. Return with evidence. Marta believed him. That was the most terrible part. She believed him because the story protected her from a harder question. If the enemy had no ethics, then her own compromises could be called necessity. If the enemy was barbaric, then Germany could still imagine itself disciplined, scientific, honorable. A lie does not always make people cruel. Sometimes it lets cruel people keep calling themselves clean. The processing center outside Liège had once been a girls' school. The painted alphabet still ran along one classroom wall. The desks had been pushed aside. Triage tables stood where children had once practiced handwriting. Marta and the other captured women were given numbers, not insults. Their names were written on intake cards. Their watches and personal items were sealed in envelopes. A woman in an American uniform entered the room and spoke German with a Hamburg accent. My name is Ingrid Weiss. I will translate when needed. You will receive a medical examination, identity documentation, and assignment to a prisoner compound. Medical staff may later volunteer for hospital work. A woman near the window asked, "What kind of examination?" "Standard," Ingrid said. "Height, weight, temperature, blood pressure, injuries, disease screening, and treatment if treatment is needed." The room went quiet. They all knew the word standard. They had been taught what it meant. Marta was called fifth. The hallway to the examination room smelled of lye soap and carbolic acid. Somewhere nearby, a man coughed until it sounded like tearing cloth. A typewriter struck in another room, key after key after key, turning captured lives into records. Inside, the examination room was too orderly. A metal table, a scale, a cabinet of labeled bottles, a wash basin, a clipboard, a folded U.S. Army blanket. Captain Ruth Halden stood at the basin, scrubbing her hands. She was in her early 40s, hair pinned under a cap, sleeves rolled with the exactness of someone who had spent her life not wasting motion. She turned and said, in careful German, "Good afternoon. I am Captain Halden. You may sit on the table." Marta sat. The paper sheet crackled beneath her. That sound nearly broke her. The captain picked up the folded blanket and stepped closer. Marta pulled back so sharply. Her shoulder struck the wall. Halden stopped immediately. I'm sorry, she said through Ingrid. You are cold. That is all. She opened the blanket slowly, keeping both hands visible, and laid it over Marta's knees. No strap, no force, no hidden tool. Just wool, rough and warm from the cabinet. Marta looked down at it as if it were a trap with teeth. Halden waited. Then she asked for Marta's name, age, unit, and medical role. She wrote the answers in neat block letters. Marta Vogel, 27, surgical nurse, Army Medical Detachment, Western Front. Halden set the pencil down. I am going to examine you. I will explain before I touch you. You may refuse any part of the examination. If you do not understand, ask the translator. Do you understand? Marta nodded. She did not believe a word, but the captain behaved exactly as she said she would. Blood pressure first. The reading is low, Halden said. Not shocking in your condition, but low. Temperature, no fever. Stethoscope. Breathe in, hold, out. Marta braced for the hand to become rough. It never did. Halden checked her eyes, throat, ears, pulse, spine, joints, and hands. When she reached the fingers, she paused over two pale, swollen knuckles. Frostbite? November, Marta said. Do you have feeling? Some. Halden pressed gently with the end of a wooden stick. Tell me when you feel pressure. Marta felt it late. Halden wrote that down. Then the captain saw the raw red line around Marta's wrist, where a field dressing had rubbed through skin during 3 days of work. That needs cleaning. I can do it. I know, Halden said, but you are my patient in this room. My patient. Marta looked up. No one in Leipzig had warned her about that sentence. Halden cleaned the wound with warm water first, not iodine. She worked the dried blood loose before using antiseptic, because she knew the difference between necessary pain and lazy pain. Then she covered the wrist with a clean dressing and wrapped it without pulling too tight. You are underweight, she said. Your gums show vitamin deficiency. Your hands show cold injury and overwork. Your back muscles are strained. There is no sign of contagious illness. I will recommend extra rations, rest, vitamin tablets, and light duty for 48 hours. Marta stared. That is all? Halden removed her gloves. That is all. You do not need more? What would I need? The question was so plain that Marta could not answer it. How could she ask why the torture had not begun? Halden studied her face for a moment. Then she said quietly, You were told this room would hurt you. Marta's mouth went dry. Yes. Halden nodded once, as if she had heard this before. I took an oath before I took a commission, she said. The commission belongs to the army. The oath belongs to medicine. In this room, the oath comes first. Ingrid translated, and every word seemed to land harder in German. Halden continued, War tells people to sort bodies into sides. Medicine cannot do that and remain medicine. Marta walked back to the waiting room with a clean bandage, vitamin tablets, and a blanket she had not been punished for accepting. The other women surrounded her. What did they do? Nothing. What did they ask? Medical questions. No threats? No. Then it will come later, someone said. Marta wanted that to be true. Because if it came later, then the lecture in Leipzig could still be right. If it never came, then something else had to be wrong. And Marta was not ready to name it. For the first 2 days, the prisoners watched everything for hidden meaning. Soap was a trick. Hot water was a trick. Real bread was a trick. The camp infirmary was definitely a trick. The women were housed in a separate barracks with straw mattresses, military blankets, and a stove that smoked when the wind turned. They were allowed to wash. They were issued toothbrushes, cloth pads, and lice powder. No one acted as if these things were gifts. The Americans acted as if they were procedures. That disturbed Marta more than kindness would have. Kindness could be theater. Procedure was harder to explain. On the third morning, Ingrid Weiss returned with a list. Medical personnel may volunteer for infirmary work. German prisoners need treatment, and the American staff is overloaded. Volunteers will work under supervision. Marta raised her hand before she understood why. That afternoon, she entered the camp hospital, expecting to find the hidden room behind the clean one. Instead, she found pneumonia, frostbite, infected wounds, diarrhea, collapsed feet, trench mouth, and men too tired to be grateful. In other words, medicine. The hospital was run by Captain Halden and a younger American physician named Lieutenant Samuel Klein. Klein had black hair, round glasses, and the restless hands of a surgeon who disliked paperwork. Marta passed instruments while Klein opened an abscess in a German corporal's shoulder. The corporal cursed Americans, Jews, Russians, weather, morphine, and everyone in the room. Klein kept working. When the infection drained, the smell made the corporal gag. "That's what happens when a wound is packed with dirty cloth for 10 days, Klein said. Marta handed him gauze. "You speak German?" "My mother did," Klein said. "Did?" "She was from Breslau, studied medicine in Berlin. She left in 1936, after the hospital stopped pretending it had room for Jewish doctors. The room seemed to tilt. Klein did not look up. She died in New York last year. Heart. Not the war, technically. Though some deaths are larger than the certificate says." Marta swallowed. "I'm sorry." Klein tied off the dressing. "She told me something before she died. If I ever treated German prisoners, she said I should remember they were patients before they were anything else. She said the Nazis could take her hospital, but they did not get to teach her son bad medicine." The corporal on the cot turned his face to the wall. Marta looked at the clean bandage on his shoulder. A Jewish doctor's son had just saved the arm of a man who might have cheered when his mother was driven out. No one called it forgiveness. It was not soft enough to be forgiveness. It was discipline. That night, Marta could not sleep. The stove clicked as it cooled. Women whispered in nearby bunks. Someone cried into a blanket without making a sound. Marta kept seeing the Leipzig slides. The strapped woman, the bruised face, the surgical tray. She had never questioned who took those photographs. She had never asked why this speaker was not a physician. She had never asked why fear had been presented as evidence. Because she had needed the enemy to be worse. Every compromised person needs a monster on the other side of the line. By the end of the week, Marta was working 6 hours a day in the infirmary. She changed dressings, boiled instruments, recorded temperatures, translated medical complaints from German prisoners too proud to admit pain to an American. The Americans were not saints. They were tired. Some were impatient. One orderly refused to speak to any German prisoner except through his teeth. Another had lost his brother in Normandy and could not look at German uniforms without going pale. But even the angry ones changed bandages. Even the grieving ones carried water. Even the ones who hated the prisoners still followed the chart. That was what Marta could not escape. The chart, not because paper was sacred, but because the chart forced the same question over and over. What does this patient need? Not what flag did he serve? Not what language does he speak? Not what would he have done to us? What does this patient need? On the 9th day, Captain Halden asked Marta to help inventory the locked medicine cabinet. Morphine syrettes, sulfa powder, quinine, aspirin, bandage rolls, vitamin tablets. Not enough of anything, but more than Marta had seen in months. Halden counted while Marta wrote. After a while, Halden said, "Can I ask you something difficult?" Marta's pen stopped. "Yes. When supplies were short in your field station, how did your doctors decide who received treatment first?" Marta felt the old answer rise automatically. Severity of wound, chance of survival, military necessity. Those were the words that made decisions sound clean. But she had been in those rooms. She knew the truth underneath. "German soldiers first," she said. Halden did not move. Marta continued, because stopping would have been another kind of lie. If there was enough after that, prisoners. If there was morphine, Germans received it first. If blood plasma arrived, Germans first. If a prisoner needed surgery and a German soldier also needed surgery, the German went in first, unless the prisoner was useful for information. The pen in Halden's hand rested against the clipboard. Did prisoners die because of that? Marta looked at the cabinet shelves. Yes. How many? I don't know. Because the number was not recorded. Because we did not count them that way. The silence in the room was worse than accusation. Marta wanted Halden to shout. She wanted condemnation. She wanted the American doctor to become the barbarian from the lecture hall, because then Marta could hate her and survive herself. But Halden only closed the cabinet. "War creates scarcity," she said. "Scarcity creates terrible choices. But there is a line between triage and allegiance. Triage asks who can be saved. Allegiance asks who deserves to be saved." Marta stared at her. Halden's voice stayed even. "If I let that second question run my ward, I stop being a doctor. I become a clerk for revenge." Something opened in Marta then. Not dramatically, not cleanly, more like a seam-tearing inside cloth that had been pulled tight for years. "We were told you had no ethics," Marta whispered. "We were told you used medicine as a weapon." Halden looked tired. "Some people do. In every uniform. That is why the oath has to be stronger than the uniform." Marta covered her mouth. The shame did not arrive all at once. It arrived in separate phases. A Polish prisoner with fever, placed behind 3 Germans who were less sick. A Frenchman denied morphine, because a lieutenant wanted the last Surette saved. A Russian boy with a belly wound no one opened because the surgeon said, "He will not last anyway." At the time, Marta had called these things decisions. Now they looked like abandonments. She sat down on a crate before her knees gave way. "What am I supposed to do with this?" Halden did not soften the answer. "You carry it honestly. Then you practice differently when you can. When I can. When the war ends. When Germany has to decide what its doctors are for." Marta laughed once, bitter and small. "Who will listen to me?" "Patience," Halden said. "Start there." The winter moved slowly after that. Marta remained in American custody through the end of the war. She worked in the infirmary whenever allowed. She learned the names of men she would once have sorted by usefulness. She watched Lieutenant Klein operate on a German prisoner with a shattered hand for nearly 2 hours, saving 3 fingers no army needed anymore. "Why spend so long?" Marta asked afterward. Klein flexed his own aching fingers. "Because he may need to button a shirt someday." That answer stayed with her longer than speeches. War measured men by what they could still do for command. Medicine measured them by the ordinary life they might return to. A shirt button, a spoon, a child's hair, a letter held without pain. These were not small things. They were the proof that a body belonged to a person, not a state. In May 1945, the barracks erupted with rumors before the official notice arrived. Germany had surrendered. Some prisoners prayed, some cursed, some stared ahead as if defeat had been a sound they had heard coming for years but had still not expected to arrive. Marta felt no relief at first, only emptiness. The country she had served had collapsed. The stories that had sustained her had collapsed. The version of herself that had endured by not asking questions had collapsed too. In August, she received permission to write home. Her parents were alive in Dresden, though the apartment was gone. Her mother wrote back on paper so thin Marta could see every word from the other side. "Tell us what the Americans did to you." Marta stared at that line for a long time. Then she wrote the truth. "They examined me. They fed me. They let me work. They treated our wounded. They did not do what we were told they would do." A second letter came weeks later from her father. "That cannot be the whole story." Marta folded the page and placed it under her mattress. Because he was right, it was not the whole story. The whole story was worse, not because the Americans had been cruel, because they had not been cruel enough for the lie to survive. Marta was repatriated in late 1945 and returned to a Dresden that looked less like a city than a warning. Streets ended in piles of brick. Churches stood open to the sky. People traded wedding rings for potatoes. Former certainties moved through the ruins like ghosts no one wanted to recognize. She found work first as a nurse in a crowded municipal clinic. There were not enough beds, not enough glass for windows, not enough soap, never enough food. One afternoon, a former forced laborer from Poland was brought in with an infected foot. The attending physician glanced at the intake card, saw the nationality, and said, "Put him after the Germans." The words were ordinary. That was what frightened Marta. They sounded exactly like the old world trying to breathe again. She looked at the man's foot. The infection had climbed in red lines toward the ankle. Delay could cost him the leg. Marta heard Captain Halden's voice as clearly as if the examination room in Liège had opened behind her. "Tridge asks who can be saved. Allegiance asks who deserves to be saved." Marta took the chart from the desk. "He goes in now," she said. The physician looked up. "You do not decide that." "No," Marta said. "The wound decides it." He could have dismissed her. He nearly did. But 3 other nurses were watching. The old confidence no longer ruled a room as easily as it once had. The Polish man went in. He kept the foot. It was the first time Marta disobeyed a German doctor for the sake of a non-German patient. It would not be the last. In 1948, Marta entered a post-war medical retraining program organized for nurses and physicians who had served under the Reich and wanted to practice under new ethical standards. Many came because they needed certification. Some came because they were afraid not to. A few came because shame had left them nowhere else to stand. On the first day, an American instructor walked into the lecture hall. Marta recognized the precise way she rolled her sleeves. Captain Ruth Halden, now out of uniform, placed a stack of papers on the desk and looked over the room. Her eyes stopped on Marta. For 1 second, neither woman spoke. Then Halden said, "Miss Vogel." Marta stood. "I kept the blanket," she said. A few students turned, confused. Halden understood. "Then let us make sure it was not wasted." The course did not begin with punishment. It began with records. Patient categories, consent, triage standards, prisoner treatment, contagion protocols, documentation, the difference between research and abuse, the difference between obedience and responsibility. Halden never allowed the German students to hide inside the word orders. Orders can explain pressure, she said. They cannot sterilize harm. Marta wrote that down, not because she was required to, because this time she wanted the sentence to stay. She spent the next 38 years in medicine, first as a surgical nurse, then as a hospital administrator, then as an instructor for young nurses who had been children when the war ended. She was not famous. She did not rebuild German medicine alone. No honest story would pretend that. But in every classroom she controlled, one rule came first. No chart began with nationality. No treatment plan began with deserving. No exhausted nurse was allowed to call a patient only a prisoner, only a foreigner, only one of them. When students complained that this sounded idealistic, Marta showed them a copy of her own intake card from Liège. Height, weight, blood pressure, frostbite, wrist abrasion, malnutrition, vitamin deficiency, back strain, treatment, clean dressing, warmth, rest, vitamins, increased rations. Signed, Captain Ruth Halden, Medical Corps. Marta would hold the card in both hands and say, "This is what defeated me." The students never understood at first. They expected a story of cruelty. People always did. So Marta told them about the examination table, the lecture hall, the false photographs, the blanket, the Jewish doctor's son who saved a German hand for the sake of shirt buttons, the Polish patient whose wound decided the order of care. Then she would say the line that became the center of every ethics lecture she gave. The oath is not proven by how we treat the innocent. The oath is proven by how we treat the person we have been taught not to see. In 1986, a letter arrived at Marta's apartment from the United States. The handwriting was small and slanted, the paper thick. It was from Samuel Klein. He had become a reconstructive surgeon in Boston. 40 years of hands, faces, burns, and bones. He wrote that he still remembered the German nurse in the Liège infirmary, who looked as if every clean bandage accused her. "I am retiring," he wrote. "My mother never saw a German hospital restored to itself. But I have met some of your former students. They argue fiercely about consent. They question orders. They treat refugees without asking whether the paperwork is convenient. That matters." At the bottom, he added one more sentence. "My mother would have called that good medicine." Marta placed the letter beside the intake card. For years, those two papers stayed in a frame near her desk. One was proof that an enemy doctor had kept an oath. The other was proof that the lesson had outlived the war. Marta Vogel died in 1993 at 86. In the final notebook she left for her students, the last page was not about Germany or America or victory or defeat. It was about a room, a metal table in a cold schoolhouse, a captured nurse expecting instruments, an American doctor holding a blanket. Marta wrote, "I thought cruelty would break me. I was wrong. Cruelty would have confirmed everything I had been taught. It would have let me remain loyal to my fear. What broke me was care, not sentimental care, not forgiving care, disciplined care. A doctor looked at an enemy and saw a patient first. That forced me to see what I had refused to see in myself." Her last line was underlined twice. Medicine begins where the exception ends.